Do you have a sore throat or difficulty swallowing? You may be experiencing tonsillitis. Tonsillitis is a common condition that affects people of all ages. Learn how to spot the symptoms and get relief. In this video, we'll share tips for treating and preventing this condition. Welcome to Meducatives. This is the official YouTube channel of www.meducatives.com. We believe that awareness is everything, and our goal is to promote it. Tonsillitis is inflammation of the tonsils, two oval-shaped pads of tissue at the back of the throat, one tonsil on each side. Signs and symptoms of tonsillitis include swollen tonsils, sore throat, difficulty swallowing, and tender lymph nodes on the sides of the neck. There are three types. Acute tonsillitis. These symptoms usually last 3 or 4 days, but can last up to 2 weeks. Recurrent tonsillitis. This is when you get tonsillitis several times in a year. Chronic tonsillitis. This is when you have a long-term tonsil infection. Symptoms. Sore throat. The most common symptom of tonsillitis is a sore throat, which can range from mild to severe. The throat may feel scratchy or itchy, and swallowing may be painful. Difficulty swallowing. Tonsillitis can make it difficult to swallow, especially solid foods. You may feel like there is something stuck in your throat. Red and swollen tonsils. The tonsils may become red, swollen, and inflamed, making them appear larger than normal. White or yellow patches on the tonsils. In some cases, tonsillitis can cause white or yellow patches or spots on the tonsils. Swollen lymph nodes in the neck. Tonsillitis can cause the lymph nodes in the neck to become swollen and tender. Fever. Tonsillitis can cause a fever, which is a sign that your body is fighting an infection. Headache. Some people with tonsillitis may experience a headache or body aches. Bad breath. Tonsillitis can cause bad breath, which is a result of bacteria and debris collecting in the tonsils. Tonsillitis is common, especially in children. It can happen once in a while or come back again and again in a short period. In young children who are unable to describe how they feel, signs of tonsillitis may include drooling due to difficult or painful swallowing, refusal to eat, unusual fussiness. Call your doctor if your child is experiencing a sore throat with fever, a sore throat that doesn't go away within 24 to 48 hours, painful or difficult swallowing, extreme weakness, fatigue or fussiness. Get immediate care if your child has any of these signs. Difficulty breathing, extreme difficulty swallowing, excessive drooling. Risk factors. Risk factors for tonsillitis include young age. Tonsillitis most often affects children, and tonsillitis caused by bacteria is most common in children ages 5 to 15. Frequent exposure to germs. School-age children are in close contact with their peers and frequently exposed to viruses or bacteria that can cause tonsillitis. Causes. Viral infections. Tonsillitis is often caused by a viral infection, such as the common cold, flu, or mononucleosis. Bacterial infections. In some cases, tonsillitis can be caused by a bacterial infection, such as streptococcus. This type of tonsillitis is known as strep throat and requires treatment with antibiotics. Smoking or exposure to secondhand smoke. Smoking or exposure to secondhand smoke can irritate the throat and increase the risk of tonsillitis. Allergies. Allergies can cause inflammation and irritation in the throat, which can lead to tonsillitis. Weakened immune system. People with weakened immune systems are more susceptible to infections, including tonsillitis. Diagnosis. To diagnose tonsillitis, your doctor will perform a physical examination. They will examine your throat to look for redness, swelling, and the presence of pus on your tonsils. They will also check for a fever and examine your ears and nose for signs of infection. Additionally, your doctor may feel your neck for any swelling or pain. In some cases, your doctor may order tests to help determine the cause of your tonsillitis. These tests may include a throat swab, where a cotton swab is run along the back of your throat to test for the presence of strep bacteria. Results are usually available within 10 to 15 minutes, but your doctor may also order a lab test which can take a couple of days to complete. A blood test, known as a complete blood cell count, CBC, may also be performed to determine if a virus or bacteria is the cause of your tonsillitis. Finally, Your doctor may check for the presence of a rash known as scarlatina, which is linked to strep throat infection. Treatment. Rest and plenty of fluids. Resting and staying hydrated can help your body fight off the infection and relieve symptoms. Over-the-counter pain relievers. Over-the-counter pain relievers, such as acetaminophen or ibuprofen, can help reduce fever and relieve pain and inflammation. Gargling with warm salt water. Gargling with warm salt water can help soothe a sore throat and reduce inflammation. Antibiotics. If your tonsillitis is caused by a bacterial infection, your doctor may prescribe antibiotics to treat the infection. Tonsillectomy. In severe or recurring cases of tonsillitis, your doctor may recommend a tonsillectomy, which is the surgical removal of the tonsils. Here are some natural remedies for tonsillitis that may help relieve symptoms. Salt water gargle. Gargling with warm salt water can help reduce inflammation and ease pain associated with tonsillitis. Dissolve 1/2 to 1 teaspoon of salt in a glass of warm water and gargle with it for 30 seconds, then spit it out. Honey. Honey has antibacterial and anti-inflammatory properties that can help soothe a sore throat. You can add honey to warm tea or simply take a spoonful of it on its own. Turmeric. Turmeric has anti-inflammatory and antibacterial properties that can help reduce swelling and fight infection. You can mix turmeric powder with warm water or milk and drink it. Ginger. Ginger has anti-inflammatory and pain-relieving properties that can help alleviate symptoms of tonsillitis. You can add fresh ginger to tea or boil it in water to make a ginger tea. Lemon. Lemon has vitamin C and antibacterial properties that can help fight infection and boost your immune system. You can add lemon juice to warm water or tea and drink it. Garlic. Garlic has antibacterial and antiviral properties that can help fight infection and boost your immune system. You can add garlic to your food or take it as a supplement. It's important to note that natural remedies should not be used as a substitute for medical treatment. If your symptoms are severe or persist, it's important to seek medical attention from a healthcare provider. Precautions. Wash your hands frequently. Washing your hands frequently with soap and water can help prevent the spread of infections. Avoid close contact with people who are sick. Avoiding close contact with people who are sick can help reduce your risk of infection. Cover your mouth and nose. Covering your mouth and nose when coughing or sneezing can help prevent the spread of germs. Quit smoking and avoid exposure to secondhand smoke. Smoking and exposure to secondhand smoke can irritate the throat and increase the risk of tonsillitis. Maintain a healthy diet and exercise regularly. Eating a healthy diet and exercising regularly can help boost your immune system, which can help reduce your risk of infections. Thanks for watching. Please visit our website www.meducatives.com. You may like our free ebooks and medical and health educational products on our website. If you enjoyed the video, please consider subscribing, sharing, liking, commenting, and pressing the bell icon to receive notifications for more content like this. Lastly, don't forget to follow us on Instagram, Facebook, and Twitter.